Hi, my name is John V. Perry, and I am the CFO of Metalytics.
And I'm Rohan, and I'm the CTO of Metalytics.
So, who here is familiar with strep? So, did you know that 42.5% of strep tests are actually unnecessary? Metalytics, providing faster, economical, and more personalized healthcare. So, what is Metalytics? Metalytics LLC leverages the patient's historical de-identified information, and we are reducing the number of unnecessary tests and therefore reducing the cost of care. There is a huge business opportunity for this product. This graph shows the number of lives managed by affordable, accountable care organizations. In 2010, the Affordable Care Act was passed, which changed the healthcare industry from volume-based to value-based. So, as this graph steadily increases, that shows that the accountable care organizations are growing. Due to the extremely high amount of data in health information exchanges and electronic medical records, there is a huge opportunity for us to market this product.
So you may ask how it works. Well, currently in the healthcare industry, there's massive amounts of data that's generated, but it's not being used. So Metalytics plans on taking that data along with the patient's symptoms and giving doctors test recommendations based on probability. In this example, this patient has a 73% chance of strep and only a 19% chance of flu. We're recommending the doctor to prioritize the strep test for the patient, but we're not telling him don't run that flu test, which is why we don't need FDA approval.
So we're going to be targeting ACOs because ACOs are the organizations that will economically benefit from our product. In our first years, we will be targeting physician-led ACOs because they are typically smaller. We will be benefiting these ACOs because we save them time since they don't have to run unnecessary tests. We will be helping them give their patients a more accurate diagnosis, and due to the passing of the ACA, they will be paid incentives by insurance companies for this turn towards more value-based care. We will also be of benefit to insurance companies because they don't have to pay for these unnecessary tests, as well as patients because they don't have to undergo unnecessary tests. In the future, we will expand our target market to larger ACOs, but physician-led ACOs are a good place for us to build our platform and validate our product. So here's a chart that shows the percent of lives that ACOs are responsible for by state. So as you can see, in Massachusetts, which is where we are starting out, around 15% of the lives are under the responsibility of ACOs. And 66% of ACOs in Massachusetts are actually physician-led. So this is around 600,000 patients that are under the responsibility of physician-led ACOs in Massachusetts. So as you can see, our target market is pretty large. Here are the three lenses of evaluation which show why our product is desirable, feasible, and economically viable. We are desirable to the customer because we save them time and help them turn towards a more value-based care. We have created a proprietary algorithm to show that we are technologically feasible, and as you will see in later slides, in year 2 of our income statement, we are able to break even and make a slight profit, which has shown that we are economically viable.
So the engine behind Metalytics is a very patentable Bayesian inferencing engine. Let's take the example of strep. When a patient comes into the office with a certain set of symptoms, we would like to predict the probability they have strep. This is a function of 3 things: probability of symptoms given strep, the probability of the occurrence of strep, and the probability of the occurrence of symptoms. Bayesian statistics is a thoroughly studied topic, and public research shows that it's very cutting-edge technology for predictive analytics. And we would like to patent our proprietary algorithm because there's many different ways to implement Bayesian analysis. So you may ask, what are the advantages of Bayesian analysis in our science? Well, that advantage is threefold. First, the parameters are estimated at the patient level. For example, the parameters that link symptoms such as sore throat to strep in patient A will be different than patient B. So this implies personalized healthcare to each patient. Second, we calculate the posterior probability by taking the prior probability plus the data, so we can fine-tune our parameters, and this allows us to get better predictive capabilities. Finally, the Bayesian process allows us to learn from hospital to hospital, patient to patient, and disease to disease. So for example, once we calculate the posterior probability in hospital 1, we can then use that data and the prior probability in hospital 2, which can then be refined using the data from hospital 2. So this is showing the advantages of Bayesian science in our technology, as with the more data we get, the more accurate our predictions can be. And before I push from the slide, I would like to note that we have been working with a Bayesian statistics expert who has validated our algorithm and is very excited to continue working with us. So here is an illustration of our science. The slope B1 is a parameter that estimates or that links symptoms such as sore throat to strep. And when a new patient comes in with the new level of symptoms, we can use this parameter to predict the probability of strep in that patient. Now, we actually have a product demo that we can show you later on at the table over there. So we simulated data from 100 patients, and we're going to focus on the occurrence of strep. And we're going to estimate the link between symptoms such as sore throat and fever to strep. And using this, we're going to predict the probability of strep in a new patient. So here's a graph. There's two patients, patient A and patient B, both with different set of symptoms, and they both show different probabilities. The Bayesian parameters over here are made by using a rundown algorithm, and we were given these numbers with our Bayesian statistics expert. So with these symptoms, in patient A, you can see Metalytics predicts a 30% chance for strep. But in patient B, it's a much higher 73% chance. So with this information, a doctor can predict that patient B must be a priority for running a strep test, unlike patient A. And this is the benefit of Metalytics in doctors and hospitals.
In our economic value to the customer, we computed three different percent reductions that we can decrease for the number of unnecessary strep tests per year. Ultimately, the goal of Metalytics is to reduce those number of unnecessary strep tests by 50%. But as you can see, even if we're reducing the number of unnecessary strep tests by 20%, we're still leaving a lot of money on the table for a small, medium, and large hospital. Ultimately, we calculated our EVC equation using the number of unnecessary strep tests times the $60 per strep test that is given at a medium hospital, as well as the number of patients that take unnecessary strep tests per year. So take the example of a large hospital. The number of patients at a large hospital is about 50,000, and the number of patients that take unnecessary strep tests is about 17,000. So 17,000 divided by 50,000 leads us to 0.425, or 42.5%. If we multiply that ratio by the number of average patients at a medium and small hospital, we arrive at the number of patients that take unnecessary strep tests, which leads us to our EVC for 50%, 30%, and 20%. I would also like to mention our market size for our product. With 16 million strep tests are conducted each year, and $960 million are wasted each year alone on unnecessary strep tests.
We have 5 main competitors, which include Cerner, United Healthcare, the Centaur Analysis, Isabel Healthcare Checker, and Athena Health. Out of all of these, no one uses patient-level parameters like we do, so no one has actual patient-to-patient differences because of our parameters. So MD Calc uses the Centaur analysis, but since they only use 5 symptoms, that means that they can only estimate up to the 50% probability of having strep, whereas we have 1% to 99% probability, so we are much more accurate. Isabel is also an online symptom checker, but they do not do patient-to-patient parameters. United Healthcare has a product called Optum Insight, but they target business agencies, and we target the actual hospital because they're the one utilizing the actual information and the product. Cerner is a health information exchange, so while we use the data to analyze it, they focus more on sharing it from hospital to hospital. Finally, Athena Health, they target the smaller business practices and the smaller size hospitals, but we target all the large hospitals and the practices, so they only target the smaller end of the spectrum, and again, they do not use patient-level parameters.
So like we said before, we're going to start out by targeting physician-led ACOs. And since our target market is pretty large, we have 3 different pricing plans to accommodate any potential customers based on how many patients they have. For example, there's a $50,000 fixed fee targeted towards a practice with 50,000 patients or more. There's a $10,000 fixed fee plus $1 per patient targeted towards a practice with 10,000 to 20,000 patients. And there is a $1,000 fixed fee plus $2 per patient targeted towards a practice with 2,500 patients or less. In our first year of business, we're going to be piloting our product to physician-led ACOs for 6 months.
As Divya referred to earlier, we will be piloting 2 physician-led ACOs in the first year, which is 1 small, 1 medium hospital and 1 physician practice. After those hospitals are piloted for 6 months, we will, if they see the benefits of our technology based on the economic value, and if they see they can adopt the technology, then they will follow our regular pricing plan, and we will break even in year 2. But since we are piloting in year 1, we are not making a net profit and we're not making a net revenue. In our income statement, we also take into account the various expenses that Metalytics will have over the span of 3 years, which include general administration expenses and the Google Cloud data storage, which offers excellent data protection and follows in accordance with the HIPAA law. Included in our pricing plan, we not only offer our technology or the ability to reduce the number of unnecessary strep tests, we also offer a front-end dashboard that helps hospitals monitor demographics as well as population change in their hospitals, as well as a tracking and monitoring system that helps hospitals track their savings based on the economic value. And we also offer a user-friendly interface that doctors can use before they send patients